Thank you again to all of our panelists and everyone attending today afternoon's Medical Festival Asia session. Thank you for everyone's support to Medical Festival Asia and Global Health Asia Pacific. On that note, Alex, the floor is yours, and to all the panelists as well. Thank you.
Thank you kindly, Varun. I understand Wyman is also on the line, but I know the team is trying to get him onto the presenter view, so hopefully that will be done in any moment. Look, good afternoon, and thank you everyone for joining us. My name is Alex Boulton. I'm a partner with Bain & Company based in Singapore, leading our healthcare practice in Southeast Asia. I've lived in Singapore for the last 20 years, and over the past few years, I've been knee-deep in digital health, providing consulting support for payers, providers, digital natives, and potential investors. And I have the great pleasure today to facilitate a discussion with three leaders in the field. Jonathan Sudharta, co-founder and CEO of Halodoc, a leading telehealth platform in Indonesia. Wyman Lim, founder and CEO of Dr. Anywhere, a leading telehealth platform in Singapore with a footprint across several Southeast Asian markets. And Dr. Alan Ong, medical director of AIA in Singapore, a leading health insurer across APAC that's been distinguished by its innovation, particularly on the digital front. So, look, first of all, a big thank you to all the panelists for taking the time out today to share your perspectives, and of course to the viewers dialed in for this discussion. The format of this session will be a 10 to 15 minute presentation on digital health in APAC, followed by a facilitated discussion with our esteemed panelists. You will have all seen the constant press coverage of digital health companies breaking new records globally and raising funds to fuel growth. The question we're continuously asked by our clients, presented with these opportunities, is how sustainable is the telehealth business model? When the COVID restrictions ultimately lift, will there be a role for telehealth in its current form, or will it need to evolve? At the end of 2019, Bain & Company launched a series of patient and physician surveys across APAC markets to test, among other things, openness to digital health tools. The timing of this survey was highly fortuitous, as it was just before the advent of the COVID-19 crisis, and so before all primary surveys became colored by the uncertainty. Now, as you'll be well aware, Asia Pacific's healthcare ecosystem is at a tipping point. We're experiencing a huge demand wave for healthcare services from APAC's 2 billion population, with rising affordability coupled with the accelerating needs associated with an aging population and rising chronic illness. In the next decade, Asia will contribute over 60% of the global increase in the population over 65 years old, and will become home to over 250 million diabetic individuals. Add to this a critically constrained supply of medical services with less than one doctor per 1,000 population in Southeast Asia overall, and double-digit healthcare inflation, the entire ecosystem risks a breaking point. We are already hearing this creaking strain in the form of access challenges with lengthening hospital wait times, skyrocketing costs, and substandard patient outcomes across many of our markets. In the context of this, ecosystem stakeholders in the region are faced with the multifaceted challenge of increasing accessibility, improving affordability, while delivering quality outcomes for patients. In our Frontline of Healthcare report in APAC, published earlier this year, we called out 6 trends that will shape healthcare over the next decade. Changing demographics, aging populations and chronic disease, rising costs and escalating medical inflation, shifting consumer expectations. The consumer's been trained by e-commerce last mile delivery convenience to find waiting for anything to be unacceptable. And they're also inclined to check their symptoms with Dr. Google before they ever set foot in a hospital. 4th, technological and medical transformation. 5th, physician capacity, or rather undercapacity. And lastly, regulators stepping up with the advent of universal healthcare in Indonesia and the Philippines, for example. Pre-COVID, we identified 4 future-back opportunities for the APAC healthcare ecosystem participants across the value chain. First, to empower consumers with a single touch point for care. Consumers want a single touch point, physical or virtual, to manage their healthcare, instead of a complicated web of disconnected care journeys. Consumers also want greater ownership and to take more control over their healthcare. They're open to changing their healthcare behaviors if, and it's a big if, they receive guidance from a trusted professional that is quarterbacking their care. 2, transition care outside the hospital walls, shifting non-emergency services to outpatient or alternative settings to relieve overcrowded hospitals. It's shocking to think there are still country markets in APAC where patients perceive 2 choices for primary care: to self-medicate at a pharmacy or go straight to a hospital. this mindset must and will change to achieve better outcomes and lower costs. Third is the increase in consumer access to digital tools and platforms. Even pre-COVID, we were seeing tremendous interest in telemedicine and self-diagnosis apps, long-term illness management tools, and electronic records. And lastly, there is a material opportunity to support physicians with AI, automation, and machine learning, with resources and tools to better enable clinical decision-making for physicians. Now, the impact of the COVID-19 crisis has been to accelerate each of these opportunities. They're no longer future back, but suddenly here and now, and it's essential that the ecosystem adapts quickly. Now, the typical patient of the past treated healthcare with both fear and reverence. I trust my doctor implicitly, but would rather only visit when something's really wrong, because the doctor will always find something. Last year, we asked patients the extent to which they agreed with the below statements. And even pre-COVID, a new type of patient was already emerging in APAC, one that has an interest in health maintenance and lifestyle changes, one that expected convenience in addition to quality of care, that researches their symptoms online before even speaking to a doctor, and what's more, a patient that expects a more responsive doctor that's happy to schedule appointments through mobile apps. Now, pre-COVID, we already saw a rapidly growing interest for increased consumer access to digital tools and platforms. 22% of survey participants in APAC claimed they had used telemedicine in the past 12 months. This was before the lockdowns. And 46% were already open to using it in the next 5 years. 27% had used digital tools for long-term illness management, and 48% were willing to use it in the next 5 years. Now, what's most compelling, though, is that 95% of patients, almost all of them, said they'd be willing to use digital health if the tools were covered by their insurance. There is a clear openness on the part of the patient to use these tools, and indeed, they may be the answer to bending the cost curve in this region. Now, during the COVID-19 lockdown, several sectors saw a spike in activity, as you can imagine. Video streaming, gaming, e-commerce, e-learning, and telehealth also shot up. This data set is from China and shows that digital health usage jumped 80% as the worst of the COVID lockdowns took root and patients had no apparent other choice. Now, this data set also reflects what happened to user activities as lockdowns ended and people were able to return to some level of normalcy. What happened then? Well, guess what? We watched everything that there was to watch on Netflix. And so for a period, activity for video streaming snapped back to even pre-crisis levels. Second, e-commerce was more sticky, staying 20% above pre-crisis levels. So there was a material shift that was sustained. And then lastly, the persistency of digital health was perhaps most impressive, remaining 70% up on pre-crisis levels. Now, and we continue to see a gradual correction, but a clear jump on pre-crisis levels remains. And so this shows us that there is some persistency, some stickiness to the change that's been delivered. Now, with all that telehealth activity, you would expect that large digital health groups are highly profitable. Now, unfortunately, that's not always the case, and here's why it's challenging and why many have failed at building out this business model. Now, on this chart, we've mapped all the popular digital health offerings, or most of them anyway, on a 2x2 that compares increasing usage penetration on the x-axis to percentage of paid penetration, so what percentage of users are actually paying for the service, on the y-axis. So think of this as, do I want to use the service on the horizontal, and am I willing to pay for it on the vertical? Now, the main challenge facing telehealth players is monetization. In the bottom right, there are several popular offerings like appointment booking, health checkers, and so on that users love but expect to be free. And on the top left, services that users value that are willing to pay for but might not have adopted completely as much as perhaps they should have. And on top of that, telehealth in this region is at times struggling to cover costs. So in Singapore, even in Singapore, where telehealth players are being able to charge $18 a consult, at times it's challenging to cover the cost of doctors that are on standby, ready to pick up the phone and it can actually be quite a bit more expensive if you haven't got the model right. And so really only things like e-commerce, e-pharmacy rather, the selling drugs online, have provided that steady path to positive unit economics for telehealth players in any sort of consistency across various business models. Now, the challenge here is that e-pharmacy faces another digital competitor. The horizontal e-commerce players like Alibaba in China, JD Health, for instance, are able to achieve a very low customer acquisition cost and logistics cost to serve on account of their expansive networks. And so only the digital health divisions of these e-commerce players in those markets have been able to break even in digital health to date. Now, that's China. For telehealth players to achieve profitability, they need to play a more important role than just e-pharmacy in the future. They need to be a trusted single point of primary care for patients that in turn opens up the ability to make higher returns from the wider healthcare ecosystem, but also the ability to add value to the wider healthcare ecosystem as well. So for example, if a healthcare player can triage and steer patients towards the lowest cost or best outcome site of care, then they'll provide a service that insurers are willing to pay for. And if a telehealth player can steer patients towards a given specialist, then it can provide a service that doctors and hospitals are willing to pay for too. But to do this, they have to build trust, and that's not easy to do. Becoming the trusted single point of care in a given market is clearly immensely valuable, but it's an uphill battle, especially from a tech company perspective. And different markets have had different success, different players have had different success. We asked patients how much they would trust each payer provider stakeholder to coordinate their care. Who do they trust the most in each market? And this is a 2019 picture. So of course, this is a moving game board, but this is the state of play today that many digital natives are moving up against. Primary care clinics commanded the highest level of trust to quarterback care in Australia, India, and Singapore, whereas patients in the largely hospital-first markets of China, Indonesia, Thailand tended to believe that they couldn't be made well unless they visited a hospital and received medicine. And so this is the type of thing that we're having to work against as we build out this new type of care. One thing to flag though is that in Indonesia in particular, the trust levels are so low in general. And that's seen in practice from the fact that there's a huge amount of medical tourism that leaves the country each year for more trusted, quote unquote, trusted tertiary care providers. Just shows that there's a vacuum that can be filled by someone or something. Only in India really do we see as yet tech companies that are successfully making inroads into that equation in any meaningful way on this picture. So look, I realize you didn't dial in to hear from me. It was more to hear from my esteemed colleagues. So I'll pull up here for a second and then hand over to some of my guests for their views. But just to summarize, when it comes to the digital health opportunity, and in many ways the investment opportunity here, first and foremost, we see digital health as an enabler to support core healthcare objectives. And that is to say, patient experience and outcomes, provider efficiency and outcomes, and for payer populations, health and claims management. This provides a level of upskilling and up capability to those core healthcare offerings. Second, we fundamentally believe that digital health has a critical and important role to play within the APAC healthcare landscape, though it's been held back historically by regulatory obstacles and resistance to change. Now, COVID-19 has broken through many of those barriers in each of the markets that we're discussing today, and we expect the behavioral change to persist, which is setting a new normal trajectory for the sector as well. Now, in the near term, digital natives have emerged as front runners in their respective geographies. However, monetization remains a key challenge for some. And really, when we think through our view on the sustainable application of digital health over the longer term, it has to involve some sort of seamless integration in an ecosystem, online, offline, potentially owned or networked. And many of the traditional payers providers are racing to partner with these digital natives to digitize and to leapfrog, so to speak. And so when you think about participating in this space, I'm always faced with this challenge and this question from my financial investor clients. if you think about this space as a total addressable market that is just the number of teleconsults that you can possibly win, you are thinking about this market wrong. The opportunity itself needs to be a lot more holistic, which is the price of care, if you will, or the cost of care for individuals on a holistic basis. And so you really need to think through the ecosystem and the platform play as you evaluate investment opportunities in some of the digital health groups here. So I imagine that there's some agreement and some disagreement in this panel. The purpose has been to be provocative. But with that in mind, wanted to spend the rest of the time really taking the opportunity to hear from our guests, bringing some very different perspectives, the Singapore telehealth perspective, the insurer perspective, the Indonesian telehealth perspective as well. And perhaps a way to start so that we can guide the questioning in the right way is maybe if we could start, Jonathan, if you'd like to kick us off, share a bit about what Halodoc is doing today.
Thank you, Alex. First of all, I think it was a very good presentation that you had. Really enjoy, and I would actually agree with your last statement about the ecosystem, which I'm going to tell a bit about what Halodoc does. So Halodoc has a mission of simplifying access to healthcare. Your earlier comment about people using Dr. Google, that's a reality that everybody is now facing. People goes to Google to ask of their problem. Now, Halodoc is basically trying to simplify access for healthcare for patients wherever they are. They can be at home, or if they need to see a physical consultation, which in your words you said about integration between online and offline. So telemedicine is just one of the tools that we provide to actually solve that problem of access of healthcare. So we do actually we gave actually service of telemedicine, telepharmacy, as in sending the medicine at the house of the patient, but we also facilitate offline services. Like recently, we actually, I think we are the largest facilitator for PCR tests in Indonesia, or vaccination on other part of the test, which involves an online booking, offline drive-through, offline physical examination, but in a very new model, I would say. So I'm definitely in the same page as what you just mentioned on your presentation, that this ecosystem play is at least that's how we look at it. So we don't, Halodoc is not just a telemedicine company. We are a company that simplify access of healthcare. Maybe I'll stop there and let my other colleague of panelists to have their
No. Thank you, Jonathan. I think just the angle on just that market need, the tipping point, the breaking point in Indonesia is just so acute that the access value that you can provide through telehealth is just really, really inspiring. And I realize that as you compare that to a Singapore market where perhaps there is already a network of GPs that is used to delivering care offline, that it creates a much more, creates a very different environment. And perhaps, Waimun, if you wouldn't mind sharing a bit about how Doctor Anywhere operates in that environment and continues to bring value to the ecosystem, that would be helpful.
Yeah, hey, thanks, Alex. And I totally agree with Jonathan, what he just mentioned about your presentation. I think this is by far one of the better sessions I've been on, right? I know a lot of facts being presented to everyone on the table right now. And to a large extent, I also really agree with what Jonathan mentioned just now, which is going to specifically to the point on the ecosystem, right? And obviously Alan has been in this game for a long time, right? He can agree more on that, right? and to me, at least from a DA Doctor Anywhere perspective, it is the telemedicine is just an enabler, right? It is just basically a tool for a feature for us to be able to have a first contact point with the users, right? But it doesn't mean that the journey should end at online, right? Because that entire ecosystem on online and offline is still very important, purely based on the limitation of technology that we have today, right? If, again, and I'll say this to everybody that I meet, if today the doctor's hand can go in from this side of the screen to the other side to touch you, then I think we're all good, right? But the truth is that you just can't do that, right? So let's all face it and understand that there is a limitation. And hence, if we all understand that with this tech limitation right now, then the next best model would then be able to fuse online and offline together, so that there's a continuity of care for the user. Be it they start off online, they can go on, they can go offline, or they can start off offline, like with a lot of CDMP patients, those chronic patients, they can eventually also go online, right? And if we are able to be successful in fusing these two together, right, then I think telemedicine or digital health, in a sense, will take off in a massive way. So COVID has only given us a good chance to start engaging people, to give them a chance to have a taste of what it could be online. But it doesn't mean that, you know, these consumers are all very demanding, right? They are very demanding people. You cannot go down on them, right? Because they are very unforgiving as well. If they taste it once, they don't like it, so they say goodbye to you, right? So it's really up to the digital health company to be able to keep them with them. And really how we measure success in at least on Doctor Anywhere, it's about how many times we can bring the users to visit us on the second time, at least. Right. So then maybe let me just introduce Doctor Anywhere. We started off as a pure telemedicine player in the GP space in Singapore. And very soon after, as we operated, we realized that it cannot just be online, right? And that's why, and Alex would know as well, we had a conversation, right, that I have been quite vocal on my view about the entire omni-channel healthcare delivery, and not just online, right? And hence, we have also moved offline. In Singapore, we own clinics. In Vietnam, we own pharmacies, right, in the primary care space. In Thailand, we have clinics as well as partners. And in Malaysia, we are building that up. So, and on top of this, right, in Singapore, we also acquired Adapt. Adapt is a TPA in Singapore last year, and I would say that to a great extent, we have integrated that into our system. And all these are all part of our effort to really build and fuse together the online, offline, omni-channel experience for our users.
Thank you, Wyman. Thank you. So it certainly seems like there is a role for telehealth in different market setups, regardless of the supply constraint, regardless of the competition, and so on. And maybe Alan, you can help explain to the viewers why it is that we have an insurer on the line versus another digital health focused group.
Yeah, thanks, Alex, and thanks very much for the presentation. I thought that was very interesting, and I really like what I heard from Jonathan and Wyman as well, because I think the vision that both of you have spelled out for your businesses, which is about expanding access to health, making something an omni-channel experience, fusing the offline and online elements. I think that's kind of the direction that we need to take telemedicine and telehealth more generally if we expect it to solve the access, cost, and quality problems that we face in the healthcare system today. I mean, Alex, from your presentation, to me, the most important statistic that I saw there was that 95% of people said that they would use a telehealth service if it was reimbursed. And really, the vast majority of healthcare expenditure in any market comes from a third-party payer. So without third-party reimbursement, it's really very difficult for any kind of health service to take off. From the insurer perspective, and I guess specifically from the AIA perspective, what I would say is that we're very interested in expanding access to telehealth for our customers because we see this as something that improves the customer experience. There's potential for cost savings, but there's also potential for us to work with more innovative telehealth providers to try and improve the quality that we get out of the dollars that we're spending on healthcare. And that's really the crux of the matter. I mean, we work with a telehealth provider exclusively in Singapore, well, not Dr. Anywhere, but so I won't disclose the name here. But really, the spirit of this is to try and expand access to care and provide customers with options so that they don't feel like they have to give up care because of inconvenience. Now, from the insurer perspective, the key question that we need to ask ourselves about telehealth is this substituting for in-person care, or is it in addition to in-person care? Because the financial implications of those two possibilities are different. If it's substituting for in-person care, then yes, there's definitely a possibility that this reduces cost, and it would allow us to provide this service without any increase in premium. If it is in addition to in-person care, then we need to look at other reasons why we might want to expand reimbursement to telehealth, and it's probably going to be along the lines of better customer experience, better quality care, because the person has more access to care. Now, we can't figure that out without trying things, right? So, and as insurers, it's difficult for us to try small-scale experiments. But at least at the AIA end, what we have been trying to do is to run some small-scale pilots and experiments with different ways of positioning the telehealth offering. And often we do this through campaigns. So it could be a time-limited campaign where we pay for some fraction of the telehealth consult. It could be a volume-limited campaign where we pay for some number of telehealth consults. And through these campaigns, we have a way of trying to experiment in a way that doesn't run the risk of breaking the bank. And I think as time goes on, as we gain more experience with how telehealth works, the financials of it, how customers experience it and use it, and as telehealth providers like Halodoc, like Dr. Anywhere come up with different kinds of service offerings, we will see more and more insurers being willing to reimburse telehealth. It's just a matter of time.
I'm sure that's music to the ears of the likes of Jonathan and Waiman.
Actually, I have a data that I can share to the panelists here, and I think a lot of the people who are listening would be very interested, and it's specific to where Alan came from with regards to cost, substituting or in addition. So in Indonesia, Halodoc works as a TPA for online and offline experience. Now, because of that, I can actually take a look at the whole patient journey of the clients that we take care online and offline. And on my 2019 data, there is a very interesting data that I can share. Now, actually, already extended to 2020. Yeah? But of the group of the population that we take care online and offline, 97% of the population who started their journey of healthcare through online do not need to go for a physical consultation for the same attributed disease. So for example, whether it's diarrhea or anything that basically telemedicine can take, 97% do not need to go for a physical consultation. Only 3% actually need. Now for those 97%, the cost compared to a physical treatment was 75% actually lower. So I don't mind to share with you, Alan, as we are basically already do a bit of that R&D for you. If you want to have, we definitely. But I think obviously Indonesia has a different demographic and cost containment and everything. So I will not use Indonesian data for the world. But definitely in my own data in Indonesia, that reality is true. And that's why today we are working with over 19 different insurance companies as a payer for Halodoc, because it's no longer a myth, but it's already a reality. And some of the clients that has renewed their insurance policy with the insurance company that work with us, actually they need to pay, they got a 25% discount on their renewable. So it's proven that actually, if it's combined well, telemedicine actually create that element of saving. So I just want to share on the point that you did.
No, and Jonathan, I think you gave, a pretty good explanation on how I think this could benefit the whole sector, right? And that's how service provider could vote insurer. In fact, just to give an overlay of Singapore, right? It's not that much different, I would say. For us, we have about 93% is instead of 95 or 97 in your case. We're 93. And in terms of cost savings, I think we have been able to reduce, at least from our existing partners today. We don't stretch to up to 75. I think it will be difficult for us, right? But I think safe to say that about 40 to 50% in the reduction is it's a pretty good estimate on where we are today when we both partners. Yeah, but I think it's also a matter of like, you know, how much the doctor costs and how much the medication costs as well. The margin is there, you know, so it is what it is.
Well, this is an important thing that's been flagged here, because the mindset of insurers, of HR benefit managers has been that telehealth is something that's a bit risky. Because if I suddenly give my employees the ability to roll over in bed at 8:30 a.m., call a doctor and get an MC, a medical certificate, well, that could, for one, increase the amount of consumption of healthcare services if it's too easy that my employees can get access to, but it could also make it pretty easy to roll over and get an MC, so to speak. And so I think with that in mind, it's caused a lot of hesitancy, especially when insurer contracts at the corporate level are negotiated on an annual basis and are quite competitive as a result. And I think so a lot of that data that's coming out of even the in-year value savings from some of these platforms that have been able to create bespoke case studies after a good year of trying it out is really, really impressive, and hopefully will begin to move the needle as well. What do you think, Alan, about that particular obstacle in the data that you've seen? Because I imagine it might be tough to get that level of saving in general.
Yeah, I mean, I think COVID has actually been a very good thing for insurers in the sense that it pushed us to think very differently about how we want to treat telemedicine. And the normal nature of an insurance company is to be extremely conservative about any expansion of benefits because we're always worried about unknowns. And unfortunately, the way it works in insurance is if something is unknown, you would rather not do it, even if there is a possibility, even if there is a more than 50% possibility that you could gain. So COVID forced us to think differently and to become more liberal, in particular about reimbursing telehealth. And I think, I was just looking at some of our internal data, and it does bear out what Jonathan and Wyman have been saying, which is that it does not appear that telehealth is in addition to physical visits. It's actually often it's substituting, and that if a visit is confined to telehealth, you tend to see a lower average bill size as well compared to a physical consult. So it's there. It's a matter of insurers getting to grips with the data, becoming comfortable with it, and you know, working it through into benefit design. I mean, I think COVID has been quite an accelerant to this, and hopefully it'll be a lot faster than it would have been if we did not have this pandemic. All the other terrible things that have happened as a result of the pandemic set aside, I think this has been a good thing because it's made insurers a lot more open to change.
Absolutely. It's a great point because I think we'll get onto the whole issue of choke points, of blockers, what's holding us back in a second. But just to reflect on that point, I mean, even when we were looking at this sector and the role of telehealth, we were envisaging the value of telehealth to really come through more clearly on years 2, 3, 4, where the improved access to healthcare professionals, to medication, will encourage patients to be a lot more thoughtful and more preventive about their care. And so, as you'll know, if you catch diabetes in the early stages, then you're able to defray much more expensive costs much further down the line. But to hear that it's saving money in year is probably not as much surprising as just inspiring. And so then the question that drops out of this is, well, if you are seeing a monetary value, what's actually holding us back? And we've spoken a bit about the payers and some of their resistance. But what else do we see as the tools that are, or rather the obstacles that are standing in our way? Jonathan or Wyman, if you want to jump in with an Indonesia or Singapore perspective, please feel free.
I think, if you don't mind, I start. From the Indonesian perspective, I think for the longest time, the market adoption has been the challenges for, I'm sure it's not just in Indonesia, but parts of the world. But I think the situation of COVID plays a big change on three aspects. The first part would be the patients. I think so. It has an impact on three categories, and I'll talk bit by bit on this. The first one is on patient. The second one is on the government. The third one is on the providers. So on the patient side, I think it's very clear the situation of COVID is a big push for everyone to actually start and use. To what Wyman mentioned just now is once a patient actually start using it, I think they just realize, especially people in Indonesia, rather than you wait for hours in the street or the traffic and everything, hey, actually you can talk to a doctor within 15 seconds. And you can get the medicine within 30 minutes. It's a mind changing, right? But other than that, the government of Indonesia have always been positive on telemedicine and digital health. But now it's even more positive because it's not just the Ministry of Health, but it's the President, the Ministry of State-Owned Enterprise. It's every single minister basically now is like pushing for, let's have telemedicine. Even like the Ministry Decree of Indonesia actually put Halodoc as part of their, like the compulsory for you to come back for new normal. So it's almost like, this is the new thing. So I think the government becomes so receptive, so supportive. And because of that, the supply side, in this case, hospitals, pharmacy and doctors, all of them now becoming so, before the situation of COVID, a lot of the supply also saying, I might not want to be part of this, or I might want to be part of this, right? But now everybody is just open. Every single hospitals in Indonesia probably have their own little telemedicine themselves, but they're also part of Halodoc. So it's now the hygiene factor. So I would say the biggest blocker in the past was eagerness to try, but because of the situation, now everybody is already part of it, and everybody is now actually contributing. Why don't we actually do this? Why don't we actually do that?
Yeah.
And it becomes like a collaboration to make digital healthcare become a great tools for everyone, not just one brand, but every brand. I think that's where we are today.
You know, it's really inspiring to hear. The way that I think about it in Southeast Asia, and I've had the benefit of being here for 20 years, just seeing how this market evolved, is I liken it to e-commerce in China. You didn't have, as you did in the US, 2,000 Lowe's stores and 2,000 Home Depot stores that were fighting to retain relevance on the offline setting in those markets, holding e-commerce back beyond its full potential. Whereas in China, you didn't have that physical infrastructure, and so you were able to see e-commerce just leapfrog Western markets and really sort of set new milestones. And I think that's what we're seeing in markets like Indonesia, where the front line of healthcare is going to be defined and then exported back to other markets where they can beg and borrow some of this best demonstrated practice example. One other obstacle that I think is particularly challenging to navigate is the integration with offline, recognizing that there are many doctors that have to play ball, and then finding a way for you to bridge the gap of taking a patient experience to be both online and offline in a seamless way. Wyman, you were mentioning that that's something that you've been particularly taking a crack at in Singapore, and would love to hear more.
Yeah, I think, and that, Alex, you clearly outlined the fact that the space that we, at least where Dr. Anywhere is playing in, telemedicine, primary care, right? It's quite different from where Halodoc or Jonathan is doing in Indonesia, because in Singapore we have I would say a more established primary care system, right? So we do have a good system of primary care, especially in the private sector. And today I would say that at least within Southeast Asia, that's the case for Singapore. We are probably the most developed one. Now, and therein also lie the problem of trying to work with a system that is already working well, right? So for us, the question is always not just about the incremental change that we can bring to existing provider, right? It is really about how we can, in a way, make changes to how they practice today, right? And in a way that it's not just about the income for them, right? So income is one, right? You know, whether they earn money or not, or more money, right? That's one for sure. And let's be honest, it will always be the case. But working in Singapore, you also realize that a lot of the doctors do care for their patients' health, the effectiveness of the treatment, and ultimately, I think that is at least where we are very aligned. How can we then integrate with the offline to bring a better healthcare outcome for the users, right? And a better healthcare outcome does not mean better drugs, for example, right? If only things are so simple, right? And Alan would have a lot less headache, you know, today, right? It is the more holistic way of approaching healthcare in a way that, you know, it can be as simple as the patient might have diabetes, right, or pre-diabetes, right? But because there is an irregular checkup, it could be because he doesn't want to go queue at the clinic, for example, right? And that leads to the next problem of, okay, they're not following closely on health, and it deteriorates, and then eventually this guy goes into diabetes, or even worse, go into hospital, right? And that then creates another whole lot of issue that is an undesirable outcome for the patient, right? So now, then it's really up to us, right, as a digital health company, to be able to integrate with existing healthcare system, right? Not just telehealth, right? Again, the whole process, online, offline healthcare, we are not trying to snatch the users from you, right? No, that's not the case. We are trying to work with you to bring better healthcare outcome for the user. That's the goal. And I think right now, I would say that at least from with the doctors that we work with in Singapore, they are a lot more open to working with digital healthcare company today, as compared to, you know, when I started this in 2016, 2017. It was an absolutely totally different environment back then.
Absolutely. And there's been a generational change as well, where we see older doctors tend to think that only 10% of consults can be done digitally, whereas the younger doctors are a lot more open to it. Jonathan, I realize you have to dash in a second for an unexpected but important meeting. Would you mind just sharing a few closing thoughts on your side, specifically as to where you see Halodoc's business model evolving in the future of Indonesian healthcare?
Yeah, I'm sorry about that, Alex, and my fellow panelists. It's the situation of Indonesia today is changing by day, and I just have to attend as very important sessions. So business model, I think we touch upon a very interesting part on your presentation about business model. A lot of the company has not shown sustainability or whatnot. I think from our side, we see this year it's being a year where we actually can prove that all the unit economics in the business the service that we do actually have gone positive. So the model that we have, again, I'm talking on the perspective of Indonesia, where we have telemedicine, delivery of medicine, aggregating the demand of medicine and medical device and supplements. Also the service that we provide in relation to the online offline experience apparently shows a positive traction towards sustainability. So I think my view is, I think we've discussed about this many years ago, Alex, when we start first discussing with you. I think a lot of us, we have to pay the customer to actually try the service of telemedicine or providers. But today, I think customers are comfortable to pay at the rate where it's sustainable for providers like us to actually make things happen.
Excellent.
So I think that's my view. Again, I'm very sorry.
Not at all. Thank you so much, Jonathan. And I understand you have to drop off, but it's been a real pleasure, and look forward to continuing the discussion later.
Yeah, really appreciate the time to spend with you, Waimun, and also Alan.
See you, John.
Hope to catch up with you on next session.
Alan, just to continue that thought and recognizing that the insurer is going to play a big role in the end state, how do you see the future role of telehealth within the ecosystem, perhaps in Singapore?
Yeah, I think from the insurer perspective, I would think that the end state would be where we recognize and reimburse telehealth, just like we recognize and reimburse many offline services today. And we will need to do not just that, but also we need to redesign the way in which we reimburse so that it's more flexible, because a lot of our reimbursement today is based around different settings of care. But when you're talking about, like Wyman has mentioned, about integrating the offline and online experience, I think you're talking about a much more complex patient journey with a lot more combinations that are possible. So we need to think about how we design our reimbursement so that it's more flexible and that it takes that sort of thing into account. I also think there's a lot of potential for telehealth to provide very graded levels of patient engagement. So the current, let's say, GP consultation model is basically about, okay, if you have a chronic disease, let's say diabetes, you see your GP once every 6 months, and the guy nags you about how you haven't lost weight, and that's why your blood sugar control is all over the map, right? We know that a lot of chronic disease management revolves around making people change behavior. And behavioral change is not something you can achieve through nagging a guy every 6 months. It requires ongoing, constant engagement. And this is where some of the telehealth solutions could really provide an answer, because telehealth digital technology makes it possible to engage on an ongoing basis. And we therefore need to think about how that gets implemented, as a telehealth end. But we also, as insurers, need to think about how we would structure financing to make that sort of service possible to deliver.
I fully agree that the biggest value is going to come from getting into the patient's pocket. It's no longer the hospital walls that's the barrier, or even the clinic walls. It's actually going straight to the patient and really tapping in, engaging on a continuous basis to nudge behaviors, which is ultimately going to be the best driver of bringing down costs. Wyman, I want to give you the final word or input here, and I have a specific question for you. If you feel comfortable asking it, I realize there's a lot of growth paths and opportunity available to Doctor Anywhere in the way that it's structured and positioned across many markets, but also within the markets. What might the end state look like for DA?
Yeah, that's a question I ask myself every day as well. I think it goes back to our vision. So Dr. Anywhere's vision is to be the largest tech-enabled omni-channel healthcare service provider in Asia, right? So it's a very big vision, and I think team is really working towards it. At the end state, I think where we do see ourselves having an operations in those countries, it would pretty much be to a great extent of what we have today in Singapore, which is an online, offline, omni-channel accessibility to healthcare for our user. When they work with us, especially when I mean they, I mean the payers, right, work with us. It doesn't have to be, something that has to be everyone takes all, right? One insurer work with just one of us, right? It could be that, we could be better in Singapore, or it could be Philippines or Malaysia. And because of that, then this particular insurer work with us in that country, right? And the end state would be that when a user think about healthcare in a particular country, they think about DA, not just from a digital health standpoint, right? But more importantly, that we are a trustworthy healthcare service provider that transient between online and offline, omni-channel, that either way, your problem gets solved. It doesn't, you don't have to second guess, you don't have to think twice about engaging us, but you know that if we can't get a good outcome for you online, we will definitely refer you to offline. And if you are you start off an offline journey with us, if we think that it's a better journey for you to be online, we'll also recommend you there, right? So that's where we see ourselves, at least in Asia.
Fantastic. Thank you for your candid sharing. Look, I realize that we're out of time, and I could probably ask questions and keep going for hours and hours, so I'll have to find another opportunity to do that. But a few things have really dropped out of this discussion for me. One is just that mission of providing access from Jonathan and Halodoc, just the ability to provide care to people that couldn't receive it. Alan, just the point you mentioned on the ability to nudge and influence behaviors through some sort of trusted integration through the insurer, through to a digital health provider, and so on. And then Wyman, especially on the importance of the online offline integration and creating that focal point of trust for the patient, so they no longer have necessarily a doctor relationship of old that is the single point of care that is the entry point to a broken and fragmented system, but instead they have a seamlessly integrated access point for care that's right for them, either online or offline or both in the healthcare ecosystem. So truly inspiring stuff. Thank you both for your time. It's been a pleasure, and thanks to Varun and the Global Health team for setting this up.
Thank you, Alex, and thank you, Rick.
Thanks very much, Alex.
Yeah.
Thanks, Wyman.
Thank you. See you.